Everybody that's tested, we're notified of. They go for their testing. They're quarantined for 14 days. We monitor them twice a day. We ask them to self-monitor, which means they're taking their temperatures twice a day, evaluating their symptoms, cough, upper respiratory distress, shortness of breath, fever. We actually get their temperatures. We write them down. We have a file on each person. So we're doing that for the entire 14 days of quarantine. And as those tests comes back, if they're negative, then we reevaluate the case to see if they're symptomatic or not, and review that with their provider, whether or not they're off quarantine. So it's different for every person, depending on their symptoms that they have in their test.
Do you know an age range of those 15 cases?
We've had a variety. We've had children as well as adults.
You were talking before about the question that was asked of Rocco, and the answer was given off mic for the sake.
I'm sorry.
It's all right. But again, what would be the testing procedure? How would somebody go about that? Are you triaging it? Just what's the protocol?
We're going to do the same procedure that we're currently doing now with our current testing facilities. So if you, and that's why we're trying to get the message out to the community. If you have symptoms, you think you've traveled to a certain country, you thought you might be exposed somewhere, you are sick, you have a fever, call your primary care provider. Those primary care providers are then in turn calling Oneida County Health Department, and our staff is assessing what criteria they fall under. Was it the travel criteria? Do they have symptoms? Were they in contact with someone? Or they don't meet that criteria, but the provider is concerned because of their other risky situations in their health. So depending on those criteria, then the determination is made with the provider that they want to test the patient. The testing centers are notified, whether it's the hospital, the urgent care, they would have to come so that the staff at those facilities are prepared and they don't just walk in and sit in a waiting room full of 30 people and contaminate everybody. So those calls are being made. They're meeting those people at the facilities doing the testing. Once we know that, we have to know their name, date of birth, address, phone number, so that we can monitor them for their quarantine, as well as know who to look for in the state database system when the results are resulted. That's how we find out. The new process for alternate site testing, once that becomes available, we'll have the same process. We will just be communicating with those sites wherever they are.
For those without a primary care doctor, what are your recommendations?
They should call ahead if they're going to think, I don't have a doctor, I've never had one, there's nobody I can talk to. I would call ahead to an urgent care before you show up so they can meet you and determine in their facility how they're going to probably put a mask on you, bring you in, and they will probably have their PPE on as well to see you. Because you should be calling saying, I think I was exposed. You can also call us at the health department if we feel that you've met one of those 5 criteria. If you don't have a provider, we could as well call the facilities to say that this person is coming. We don't have a doctor because that facility will have to be your ordering physician.
Many people make decisions on healthcare based upon costs. How's that going to be done?
The only cost information that we have currently from state government is that insurance companies will not be charging copays for COVID testing. That's been determined. I don't know any other regulations that have come through.
You said you're waiting for results on 15 pending tests right now?
That was this morning. It could be more by now.
What's the total tests that have been performed at this point?
I think we were monitoring last night 26 people.
So that's from the start to this point, some of them?
No, we're currently monitoring 26. So we've had some go off monitoring.
And
so I'd say about 30-ish.
How many test kits are available?
The test kits aren't really a kit. If anybody's ever been tested for the flu, have you? With a swab up your nose and down your throat, that's the test. So that's the equipment for the swab that would go in your nasal pharynx and your oral pharynx and swab you, put them in a tube like you do for flu, because there's many other viruses that you can test for. So those tests in the swab kits are sent to a laboratory. The kits I think that people refer to are what the lab needs in their testing facilities to run the tests and get the results. That make sense? Yes?
What's the typical turnaround time for a test?
Early on in the season, when it was in January or early February, it was 24 hours. Then it became 48. We're currently waiting 4 to 5 days, some of our tests. And as you know, initially it was only the New York State Wadsworth lab that was doing the testing. So it was a pretty tight turnaround with them. You know, the numbers were less, et cetera. But currently there's other commercial labs. They have now been finally approved. So it could be a matter of them wrapping up their resources and staffing and phlebotomists, lab technicians and all. They have to run the tests. So they got approval. They probably have to wrap up their staff and resources to turn their tests around as well.
For those individuals that have been tested and determined to be negative, I know that there's probably all different circumstances for each of those. But generally speaking, has there been any conclusions that they were otherwise just suffering from a cold or something else to explain why they felt, aside from just precautions, that they were worried about where they might have traveled, that they actually were feeling some sort of symptom?
Actually, some providers were ordering other viral panel, respiratory panel tests, which are just different types of viruses by name. And some of them did come back with those other positives. And some providers also ordered flu. Some came back positive for flu as well.
I don't know if it was said by Phyllis, but I think, the other point that if they are, and we talked about if they're being tested and it's pending, they have to be in quarantine. If it does come back negative as well, in those early days, they still have to remain in that quarantine because because they were tested. So if someone's tested, the results come back within the first 3 days, that quarantine time starts, and they still have to remain in that quarantine for the 14 days. To be clear, everybody get that? Even if it's negative, it still has to be.
Is there any need to do, because I know sometimes we hear different information and nationally, whether, is there a need to do a second negative test at some point to determine or absolutely confirm?
If the first one's negative and you're still symptomatic after a certain amount of time, especially through that quarantine period, there may be. There's also additional testing if you're positive. You've finished out your quarantine period. You have to have 2 separate additional negative tests before you can be released.
Do you remember how many total have been tested so far?
Well, as of last night, we were still monitoring 26, so those are all tests, and we've had a handful that went off. So I'm going to say maybe 30. Don't quote me too much on it, because it changes every minute.
Could you explain why the 14-day quarantine period?
It's usually the period where your incubation period is, so a lot of diseases and viruses and many other diseases as well. That's your incubation period where you could potentially be infectious to pass on to someone else. And that's the research that occurs to determine that.
We, during the Facebook Live, somebody listening had asked if there were any at-risk pregnancy county workers, if they'd be allowed to work from home.
No, we're evaluating all those situations. Obviously, every population's at risk, and clearly, whether it's elderly or young, whatever, and clearly pregnancies in those regards. We're evaluating who, depending on the job and what they have, work at home, and we're also obviously telling our employers if they're not feeling well, they should stay home anyway. So we're working through all of those issues. Anything else until we break off here? So thank Phyllis, obviously, and again, we've had all hands on deck here, and we will for the next several weeks regarding this. Again, just going back over, this is a different state of emergency than we've seen in the past, which will, at least over the next week or two, probably the next 2, we'll do daily briefings on this so that you can be updated. We're looking at, I think, doing them, during the weekday in the afternoons at 3 o'clock, unless we get a positive, at which we will do that as quickly as within the time frame that we've been notified of a positive case. That'll change the daily briefing, in that regard. But we want to do this. We want to keep, there are going to be changes regarding some of the conditions of the state of emergency that, may be impacted by either state actions, federal actions, clearly, local actions in terms of testing and positives, and if those come up. So again, we want to, as I said from the beginning, we're going to be clearly responsible, transparent at all times. We'll get as quickly as we can information. We'll do this on a daily basis, but it'll change, accordingly if there are any positive tests. Anything else? Did I leave? Let me just turn to Phyllis, and if I left, and then my commissioners, if I've left anything out, and I missed anything. Yes, Rick.
I have one more question.
Sure.
Either you or Phyllis,
Yeah.
whoever wants to answer. With the cases that you're testing for now, and you haven't had any positives at this point, but is there any, I guess with the assumption that any tests that might come back positive are immediately linked to what came out of China, or is it possible that there could be strains of positive COVID that are separate from what's going on in the rest of the world right now?
I think the COVID-19 is what we're actually testing for. So there's other coronaviruses out there. So as I said before, you can test for various different viruses, but right now the testing is for COVID-19, so we're assuming it's the same coronavirus that started in Wuhan.